Okay, so this is actually a surprisingly tough thing to answer. And that's only because I've gone to do so many different placements over the last 4 years. But of all of them, I'd probably say my first year elective in orthopedics, just because I got to assist in theater as like the first assistant surgeon almost the entire 2 weeks that I was there, and I got to visit a place I've never been. However, I've been on 2 different rural placements, one of them lasting a month in the middle of the outback, and then one of them for 6 weeks up in the Cape, which is like near the top of Australia. Again, I probably would never have gone to those places if I was in like any other degree other than JCU. And then most recently this year, I've also been to Brisbane as well as TUH. Okay, so first and foremost, congratulations. That is actually massive news. That's really good to hear. 2, JCU I found is very person specific, as in, like, as much as no one likes to hear this, on paper, everyone applying to medical school is roughly like in the same boat. So then what it ends up coming down to is, are you able to hold a conversation with your interviewers? Do you have good fun stories to tell that showcase different attributes about you? So whether that's like your leadership, your perseverance, your ability to work in a team, things like that, as well as like your hobbies. Who are you outside of academics and academia? Those are all good things to kind of consider and bring up. And then also just have some general knowledge about stuff that's going on in the world. Just because that can. Okay, so my last video got cut off, but this is essentially general advice for anyone applying to medical school. A lot of the times it genuinely comes down to who you are and how you're able to showcase that, and your own personality and what you yourself bring to the table to the medical admissions committees. So for different schools, what they put emphasis on looks a little bit different. So for example, JCU has a lot of emphasis on social accountability and helping in your community and things like that, rather than, say, being very research intensive. We tend to care more about underserved populations and things. Not to say that it's a good or bad thing to bring up both things at any medical school interview if you are interested in that. So yeah, bring up things that you're passionate about. Try to answer the questions concisely and just have fun with it. So this is both yes and no, as in for JCU specifically, we have our accommodation covered and we get our travel costs subsidized during our rural rotation, and like our rural rotations, which happen in 2nd year, 4th year, and 6th year. And then in between, you can apply for travel bursaries to other placement sites. So that's in 1st year and in 3rd year. When you do your emergency medicine placement, if you do it outside of one of the clinical school campuses, so whether that's Townsville, Cairns, or Mackay, or like I did mine in Brisbane, so I had to pay for my own travel and accommodation in Brisbane. I got lucky because I stayed with my friend who was doing placement at the same time. So some of our placements are covered, others not so much. So I think I get asked this both in my personal life and on here every time I've ever done one of these. But right now, I'm about 95% in the camp of staying in Australia, and 5% on going home or, say, going to the UK. The big things that come up with this is why and what about your family. So I'm really lucky. I've got my cousins that live in Australia, down in Melbourne and Sydney, and then my mom and dad are actually both down to move here as well afterwards. And my older sister wants to stay in Canada, so there's that. And then the other question is why in terms of training and things, because it does take a bit longer here. But my thought process was I've been trained in this system the last 6 years. So it doesn't really make sense for me to just pack up and leave, because I know how this system works and I kind of know consultants. And so just to continue with this question as well, I'm fully not opposed to going back to Canada by any means. Like, I'd definitely go and do a fellowship there once I'm done my residency training here. But I think for the specialties that I want to do, which right now is orthopedic surgery, pediatric surgery, or maybe neurosurgery, it's very, very competitive to try and get a job back in Canada right away for residency, because you'd be applying as an IMG or an international medical graduate. Whereas here, it's more about finishing your internship and then kind of doing your PHO years and then your residency years. And a lot of that comes down to your CV and who you know and your actual skill set, rather than necessarily a match-based system like we have back home and in the US. So campus life at JCU is honestly amazing. I think I've had more fun in medical school than I have during undergrad or high school or anything. In saying that, at most medical schools and like at most universities in general, there's usually clubs and different social groups and activities for just about everything that you can think of. In our med school, I've been involved in our medical student association and our surgical society as well. Like this year I'm the vice pres. I've gotten to design merch, organize scrub crawls, various academic events, guest speaker nights. We've got med ball, we've got our halfway ball that just happened recently. For my cohort, there's grad balls. There's also other like random clubs across the uni for like different interests. So if that's like diving, scuba diving. So I was mentioning the other clubs on campus that we have. So like I mentioned, there's like a diving club, a scuba diving club. There's a wrestling society or a team thing that I found out about recently. We've got all sorts of social sports. So think so there's interfaculty sports as well as just general social sports. So interfaculty will be the College of Medicine and Dentistry alongside the pharmacy students, going up against the business kids or the law students or the vets or education in different sports. So if that's like touch football, soccer / football, basketball, netball, all things like that. What else have we got? There's different religious groups on campus as well, if that's something you're into. So yeah, tons of things to do on campus. Med school is great. So probably last question I'll get to answer before I have to drive off to the hospital, because it's about 6:45 now. But the best resources that I've found to be of use this year, now that I've started like my full clinical years, is ETG, which is like therapeutic guidelines. Up to Date is really good. BMJ Best Practice is really good. Osmosis, sometimes I don't really use it, but I know a lot of people that do. And a lot of people in pre-clin swore by Ninja Nerd videos. Personally, I didn't watch that much Ninja Nerd, but his content is amazing and it does cover a lot of really good aspects of clinical medicine as well. Yeah, I think in pre-clin, I mostly just used our lecture content. And then this year, I've started to branch out into more like up-to-date ETG, AMH, things like that. Okay, so like with most things, this depends on the school that you go to. From my experience with JCU, for my first 3 years, so year 1, 2, 3, we did it in semesters. So you had mid-year exams and then end-of-year exams. And we started school in February and we'd end in November for like our full year. And you'd have your exams in June and then November. So now that I'm in 4th year and then 5th year, those are 2 last sets of exams. And those are like our full clinical years. the academic calendar gets shifted to starting in January and then ending in November, with our only major exams being in November. So again, it's subject to vary depending on which school you go to, but the academic calendar in Australia roughly starts in either January and February and then ends in November. Okay, so just got home, and to answer this, I think it would depend on the province that you're from. So I'm from Ontario, and it took me about 15 minutes to get mine converted, as in went to the DMV, showed them my Canadian license, and then they just gave me my Australian one, and I didn't actually have to like hand in my old Canadian one. But I think for certain other provinces, you might have to do like a driving test or something. And Australia also has some rules on their licensing requirements if you are over the age of 21 or under the age of 21. At the time, I was 22. So I just got like a straight open license. I didn't have to do any tests or anything. But I think if you're under the age of 21, then you get like a provisional license. Okay, so this isn't something I've looked too deep into just because general practice isn't something that I personally want to do. But there's two colleges that accredit you into going into family medicine or general practice. And that's RACGP and then ACRM. I believe the training program is about 5 years long in total. So if you go into ACRM, which is for rural and remote medicine, you become like a rural generalist, which is like a rural GP with some additional skills in various other specialties. That one you can start right after medical school, and it takes you about 5 years to finish that fellowship. Whereas with RACGP, you do your internship years, which is 2 years, and then you do another 3 years of residency training, and then I think like another 2 years in like a subspecialty. Okay, so I will end my little takeover on this question, and I think it's also a bit subjective, but for me personally, it's definitely been all the friends I've made in medical school, mostly just because these are people that are going through essentially the exact same thing as you, and the bonds that you're able to form throughout that experience isn't like anything I've had before, where everyone is like going through medical school, yes, but then you're also making a lot of fun memories and doing a lot of fun things on the side of that. So that's been really great. And I think also the most rewarding thing has been seeing the impact that you can actually have on people's lives, both as a med student and then as a doctor. Like, there's been plenty of times on placements where I've had, firsthand help. Okay, this is part 2 of answering that question. But yeah, there's been plenty of times on placements where I've had firsthand experience, essentially being the provider for that person, whether that was on rural or in the ED, or doing all my own workups and my own follow-up of that patient, obviously under supervision. Getting to do all of those things is really rewarding, and you get to learn a lot more about yourself and how you react and interact within a given environment and under XYZ scenario. But yeah, I'd say all the experiences I've had dealing with people and helping them get better, and then also all of the friends I've made in medical school, is probably 2 most rewarding things. And again, thank you guys for having me on this takeover. If you have any more questions for me, just let me know on my own Instagram.